is Adam. He is 12 years old. Eee, Mommy, my tooth hurts and there are black spots on my teeth. Have you ever experienced a toothache before? If you have, it's probably due to caries. Did you know about 3 in 5 adolescents aged 12 to 19 had experienced dental caries in permanent teeth, and 15% had untreated tooth decay? So, the question now is, what is caries? Caries is actually another word for tooth decay. How did Adam get tooth decay? Let's take a look into Adam's life. Adam doesn't like to brush his teeth. He doesn't like to floss too. He hates the dentist. But Adam likes to snack on sugary food, such as sweets, ice cream, cake, and chocolates every day. He also loves carbonated drinks. Coke is his favorite. He drinks them every hour. As months go by, more and more plaque accumulates on his teeth due to his poor oral hygiene. Let's take a look into what is plaque. There's a lot of bacteria in the plaque. One of the most common bacteria is strep mutans. These bacteria feeds on sugary food you eat and produces byproduct, which is acid. These acids act on the hardy protective layer called enamel to form an initial cavity. The cavity gets bigger and bigger as the acids wear down a pathway for bacteria into the tooth's secondary layer called dentine. As the damage progresses into the pulp, where the nerves are located, it will be painful. Now that we know how caries are formed, let's take a look at how to prevent it. First, Adam avoids sugary food and drinks. Did you know? Eating sweets frequently has more serious effects than eating a large amount in one go. Sugar intake should be limited to 6 teaspoons for women and children and 9 teaspoons for men. A can of Coke has approximately 3 teaspoons of sugar. Second, Adam eats healthier foods such as carrot, apple, brinjal, and milk. Not only that, Adam visits the dentist every 6 months for regular checkup and scaling. At the dental clinic, the dentist applied fluoride varnish to his teeth. Fluoride varnish helps to keep the enamel strong and healthy, which gives you white and bright teeth. The dentist also does a procedure called fissure sealants, which forms a protective layer that keeps food and bacteria from getting stuck in tiny grooves on the tooth surface. Besides that, Adam brushes his teeth twice a day and flosses at least once a day. Now, let's recap everything and see how Adam brushes and flosses his teeth.
Why do we brush? We brush to remove plaque and stay clean.
What's plaque?
Plaque is yucky stuff that can stick to teeth. Plaque is bad because it's full of nasty germs. These germs can hurt teeth by making little holes called cavities.
No!
Plaque and cavities make teeth weaker. That's why it's super important to brush all the plaque off every day. To keep healthy teeth, we have to brush for 2 minutes every morning and 2 minutes every night before bed. It's really important to brush your teeth the right way. First, make sure to use a special kid's toothbrush when you brush. Kids' brushes fit little mouths and have soft bristles. Put a little dot, about the size of a pea, of fluoride toothpaste on your brush. Parents have to help babies brush their teeth. And babies can't use fluoride toothpaste. You have to be able to spit to use fluoride. Once you have the toothpaste on your toothbrush, open your mouth wide. Start with the teeth in the back of your mouth and brush in little circles. Work your way to the teeth in the front of your mouth. And don't forget to brush the gums. Move the brush back and forth, gently in short strokes. Brush the top, front, and back sides of each tooth. Make sure you get the insides of all the teeth. When you're done, be sure to spit out all the toothpaste. Don't swallow the toothpaste. It will upset your tummy. When you're done brushing, it's time to floss. Flossing can help remove food and plaque from in between teeth and along the gum line. Parents should start flossing their children's teeth as soon as they have 2 teeth that touch, and they should floss twice a week. When you floss, break off about 18 inches of floss. Wind the floss around your pointer finger. Hold the floss tightly between your thumbs and your fingers. Guide the floss between your teeth using a gentle rubbing motion. Never snap the floss into your gums. When the floss reaches the gum line, curve it into a C shape against one tooth. Hold the floss tightly against the tooth. Gently rub the side of the tooth, moving the floss away from the gum with an upward motion. By the time you're 7 or so, you should be flossing every night at bedtime with your mom or dad's supervision. One other way we can keep our teeth clean and healthy is by eating and drinking healthy foods. Eating healthy foods for breakfast, lunch, and dinner is the best way to keep your teeth and whole body in good shape. If you're hungry and want a snack, try foods like fruit, raw veggies, and low-fat cheese. Stay away from sugary sodas and sweets. If you're thirsty, drink water or low-fat milk. If you brush, floss, and eat right, you'll have a beautiful smile for your entire life.